Well, hello, free people of the Rocky Mountain region, and welcome to this Free State Colorado interview. Today, I'm joined by Matt Valliere, Executive Director of the Patients' Rights Action Fund and the Institute for Patients' Rights, both of which advocate against physician assisted suicide policies. Well, Matt, I hope you are well, and thank you for joining me today.
Thanks for having me, Brandon.
Well, in 2016, Colorado voters approved the legalization of physician assisted suicide, sold as a way to help terminal patients end their suffering. Proposition 106 passed with 64% of the vote, making Colorado the sixth state to enact this type of policy. But a recent article is raising concerns. Matt, you recently wrote a guest commentary that was featured in the Denver Post about your friend Jane Allen. Jane was diagnosed with terminal anorexia, and what happened next shocked me. Can you explain, Matt, what happened to Jane?
Sure. So Jane had been battling anorexia for nearly 2 decades, most of her life, and certainly all of her adult life. She was being treated for her mental health disabilities, including anorexia, in the Springs, and where she was living, and she had a job, and she was functional, but definitely struggling, you know. So her mental health professional suggested that she go just do a consult at a boutique eating disorder clinic in Denver, where she was admitted as a patient. Over the course of some time, she received treatment from them, but it seemed that she was not getting better in their eyes, and this idea of terminal anorexia, very new, and actually came out of this boutique clinic. Um, it's not a true diagnosis, right? So this is just some turn of phrase that this doctor has coined, and now it's been spreading around, especially in the assisted suicide circles. So physicians who have a penchant for assisted suicide are talking about it and trying to figure out like how to qualify patients for it and this kind of thing. In addition, it broiled the eating disorder community into a very divisive debate over whether or not there was such a thing as terminal anorexia, many believing that the term itself is even dangerous to their efforts to save young people and others. I mean, the eating disorders don't discriminate based on age, but this is it going to harm people just by the very existence of such a term, right? Because is there any clinical evidence to understand who's going to live and who's going to die with a eating disorder? So she was given this diagnosis, but the conversation kind of came up with this her doctor at the boutique clinic, as she described it to me. Over the course of a year, we became friends because when the the main doctor of the boutique clinic, she wrote a peer-reviewed piece in the Journal of Eating Disorders, coining the term and describing three different cases of what she considered terminal anorexia and people who received lethal drugs under the law. Now, Jane saw that article. Uh, as she wrote, there was another doctor, eating disorder doctor at Johns Hopkins in Maryland, who wrote against this position. And Jane wrote to that doctor and said, "Hey, thank you so much for standing up for people like me. I was one of her victims." So that physician was an allied doctor of ours, and she asked Jane if she could introduce her to me, which she did. And Jane and I developed a friendship over the course of a year, during which time she expressed a real strong desire to tell her story, um, because she saw how dangerous this public policy is for people who are in the circumstances that she was in. So she was told she had terminal anorexia and offered what they call the palliative route. So this is where they stop trying to help the person to recover from their mental health disability, from their eating disorder. And recovery means different things for different people. So it's you can still be struggling and but be functional and living your life, right? So uh, they basically told her her case was hopeless, and qualified her for hospice care, and then ultimately referred her to a doctor that would qualify her for lethal drugs. Different doctor. Jane described it to me as having a coming out of a morphine-induced stupor in an inpatient hospice setting with lethal drugs at her disposal, not having remembered at that moment that she had requested them. She had indeed requested them many times because many people who are in these difficult circumstances, they want to die, uh, just like anybody else who's suicidal. And they see assisted suicide, some, as an option, as a way out of what they consider this intolerable situation. As many suicidal people see suicide as a way out. It's not the desire for suicide is often ambivalent and is often it comes and it goes. So not everyone who's suicidal today will be so tomorrow. And oftentimes you see people who are very happy that they were stopped. And that was the case with Jane. So Jane's parents found out that she had lethal drugs at her disposal. Her father applied for guardianship in the state of Colorado. He had had guardianship in Missouri, and then that got approved through a court, through the judge, and he immediately had the drugs destroyed. Jane experienced this very difficult, traumatic thing, and she wasn't by any means on necessarily great terms with her family at that moment. Uh, but she started getting better. As she described it, I ate just enough to not die right away, and then slowly I was getting better, and I ate a little more. I weaned myself off of the heavy drugs they had around at the end of life care place. Um, and eventually she just walked out because, in part, the boutique clinic who had qualified her for hospice considered her a liability. And my suspicion is because her parents would have taken legal action against them if they were continuing this course, but unknown. They dropped her from their care, and as she said to me, the hospice facility said that she needed to leave. So she walked out. She got a flight back to Missouri, got back on her feet, got some good mental health care, ended up getting back up to healthy weight. A woman who was told, you are a hopeless case. A woman who was told, you have terminal anorexia. You will die in 6 months or less. And lo and behold, she moves to Washington State where she got a new job. She bought a house, got a puppy, was dating again, had a great friend group, did activities. She traveled, she hiked. Um, and for a year, she was planning on going public with this story. And the week before she passed away from complications of having starved herself for over 20 years, um, she died. So she died a week before she passed away. Uh, she had said to me, "Okay, I'm ready. Um, call NPR." And she herself called the New York Times. The New York Times was literally had conversations with her. They were going to fly out to Washington the week she died. They canceled everything, obviously. Um, she was a gem. She was an absolute gem. And I myself, as I said in the op-ed, I just wonder in the 11 months that she was um, in this care facility with lethal drugs and hospice and she wasn't receiving the protocols for eating disorder care and treatments. If she had been, would her organs have been so distressed as they were to give out on her in the end, a few years after recovery? Or I guess it was 2 years. Give 2 years. So this is a person who had recovered. I mean, for all intents and purposes, not like she didn't have hard days. She absolutely had hard days. Um, Was she completely out of woods? I can't tell you that. I have no idea. But I do know that this is a person who is an obvious success story, um, and who was put at risk of deadly harm and absolutely was discriminated against in the course of her treatment. And it seems to me that this law obviously allows for that, and she's not the only one. Yeah, there's in the Colorado annual reports, you can see they have this bizarre category for their underlying conditions, various categories, cancer, like neurological disease, da da da. Like there's one that's severe calorie malnutrition, severe calorie malnutrition. And of course, I'm sure there are some illnesses or things that besides eating disorders that would render a person having 6 months or less prognosis from calorie malnutrition, but one would have to imagine that there are some of those that are anorexia patients, right? And what does that say about the law? What does it say about us as a society? These cases are publicly known. Not been one single prosecution, zero. Um, Even the organization that was the main proponent organization of assisted suicide in Colorado, uh, when they heard about the idea of terminal anorexia, they made a public statement, probably a damage control, even though some of them probably think it's just fine, saying like, that's not what assisted suicide's for. Yet, at the same token, they do zero things with their very large 20 million a year budget to amend the law in Colorado or anywhere else where it's been legalized. They change nothing about the model bill where they propose it in some 20 states every year in order to protect young people with eating disorders from assisted suicide. And so you have to ask yourself some hard questions as a society, as people, legislators considering this in other places, and even in Colorado, you know, uh, what are we doing? What does this law actually allow? Are we okay with this collateral damage? And I mean, if so, how many is too many? I would say one. One's too many.
Wow. Wow. Well, I really appreciate your efforts, Matt, to stand up and speak out for individuals who are in these horrible situations. I can't imagine an individual who's suffering, who's, depressed, who's been told by a doctor that there's nothing we can do for you. You have very little time left. You want to end your suffering. I mean, it seems somebody in that kind of mindset is more likely than not, at least in some situations, to say yes, to go for it. But how fair is it for that individual to be presented with that option, to be told this is your only way out by a medical professional, and they go with it oftentimes, unless they get some sort of intervention from maybe a family member. I mean, you talked a little bit about how Jane was discriminated against. Can you go into that a little bit? Because that's, I know, a portion of your lawsuit, the lawsuit from your organization against the state of Colorado to overturn assisted suicide laws, the discrimination aspect. Can you go into that a little bit?
Sure. So the main qualifier to receive lethal drugs in Colorado is having a 6 month or less prognosis from a doctor, or now a advanced nurse practitioner, I believe is the level of nurse that they allow for it. The 6 month or less prognosis can be with or without care. Every single condition that renders a person having a 6 month or less prognosis is a person with disabilities under the ADA. So this is the Americans with Disabilities Act. There's follow-up legislation to it federally called the ADA Amendments Act of 2008. And of course, there are other federal anti-discrimination law, both in statute and in the Constitution, that protect the rights of people with disabilities for equal treatment in society. So if I lived in Colorado and you and I both went into a doctor and asked their help in killing ourselves, if one of us, say it's me, say I have a life-threatening condition and you don't, if they were to help you to kill yourself, they go to jail, they lose their license, and your family's going to sue them. Those are the liability protections that are in place to protect vulnerable people from bad players. In every state in America, it is illegal to help another person to kill themselves. Um, Except when that person happens to have a 6 month or less prognosis. In that doctor's estimation, it might not be an actual terminal disease. So whether or not it's terminal, it might very well be terminal. Say it's like stage 4 inoperable metastatic cancer. This person clearly has just like 2 weeks left. The likelihood that they're going to die is extreme level high, right? So call it like 99% going to die. That person's quote unquote terminal. Even for them, in another state where assisted suicide is not legal, if the doctor would help them kill themselves with lethal drugs, a prescription for lethal drugs, they would, again, go to jail, lose your license, and your family would sue. Except in Colorado, where now these laws do nothing for patients. There's no states, including Colorado, that prosecute or criminalize in any way somebody attempting suicide. They don't. No states punish the families anymore. This is off the table in the United States because we see people who kill themselves or are attempting to kill themselves or would like to have thought about it. We see them as actually victims because they themselves are suffering and they don't see any way out of that. So now you have uh, go back to the scenario. You and I both go in. Typically, and it is the standard of care, if you were to request help in killing yourself and you don't have a 6 month or less prognosis, they're going to provide you with suicide prevention care and services. It is the protocol. There's a whole set of things that gets triggered by even the mention of killing oneself or harming oneself. And all of those things go into effect, up to and including, and we don't necessarily agree with this, but uh, the standard of care is if we're worried that you're going to walk out the door and or hurt yourself, that medical professional must forcibly admit you to the psych ward for a 48-hour hold. And then the psych ward can determine whether or not they're going to invoke a 2 week hold, 14-day hold. This is to protect vulnerable people from themselves, from whatever they're struggling with. Uh, the state has a vested interest in doing this. There's so many people who were helped in that way, uh, whether of their own volition or not. They come out on the other side and they're very grateful to be alive, whereas they would have otherwise killed themselves. In Colorado, if that person has a 6 month or less prognosis, they're not getting the standard of care. They not only don't get the standard of care, they're getting proactive help in killing themselves. What's the big differentiator between you and me in that scenario if I have a 6 month or less prognosis? Disability. They are discriminating based on disability. They treat you in one way and me in another way because of my disability. You get the standard of care, I get different and lesser care. And in this case, not only different and lesser care, that results in my death. So we are claiming in the lawsuit that the assisted suicide law in Colorado is inherently discriminatory, that it violates the ADA, it violates, there's a statute called the Rehabilitation Act. It was the Section 504 of the Rehabilitation Act as a sort of precursor to the ADA. We are claiming it violates Section 504 of the Rehab Act, as well as the Constitution, equal protection under the law. Most suicide prevention care and services are, at least in part, funded by the federal government. And so if you're protecting some people but not others, you're violating the Constitution. So this lawsuit, were it to be successful, would overturn the Colorado law. Now, could proponents try to pass another law that would somehow hypothetically get around a ruling? It would depend on how narrow the ruling is. If it's what we're asking for, as far as I could tell, they'd either have to give suicide help to everybody or nobody. So I don't think that we're ready to, as a society, I don't think the legislature would pass an assisted suicide law that said, 18-year-old girls with a messy breakup can go into their doctor and get suicide help. Nobody's ready for that, right? So that's as heinous as a doctor helping, 25-year-olds and 28-year-olds with eating disorders to kill themselves. So here we are. Um, you have a law that cannot stand put up against federal anti-discrimination law. It just flies in the face of equality in this country. You just can't treat different people differently. It would be like saying, like Middle Eastern looking guys, if they ask for suicide help, we give it to them. Like, no, we don't do that, right? Like, it's just not what that's discrimination. So that's the way in which this is discrimination against people with disabilities. And look, like I'm not saying that nobody with a 6 month or less prognosis is truly terminal. I think there are plenty of people who qualify for the drugs who can get them, who are going to die of the underlying condition within 6 months. There are also people who qualify under this law who would not die in 6 months or less if they had proper treatment. So, like somebody like my dad, for example, he's got diabetes, he takes insulin. There are people every year who qualify for lethal drugs under this law who get off their insulin, or they don't have access to the insulin. They might get denied coverage for as much insulin as they need, and now they're rationing and they can't figure it out. And so whether you are in some way facing hurdles to get the care you need to live, or you in a dark moment, you were talking about depression and um, other factors, stressors, societal, mental health, what have you. Are these truly autonomous decisions? Hard to say. I would venture no, not all of them are. I mean, but maybe there might be some people in some world that are making this decision in a way that is truly and deeply autonomous. But because, especially people with disabilities, get the short end of the stick in healthcare, and I'm talking like 80% of doctors in a recent Harvard study thought that life with a disability was less worth living. They more than half were not convinced that they could accommodate people with disabilities in their practice. Yet, if you're facing that kind of discrimination in healthcare, that's softer discrimination, and then there are people who I have lots of friends in the disability rights community. I have friends who were told to their face by their medical team, like, I would rather die than live like you. When somebody says that to you, how demoralizing is that? And then in a state like Colorado, they can then turn around and many of these people with disabilities auto qualify at all times for the lethal drugs. They can turn around and give you a hand in killing yourself. So, and I'm talking people like, yes, mental health disabilities like anorexia that have a high lethality rate, they would qualify. And you know what has the higher lethality rate? Opioid use disorder. So if terminal anorexia, then so too terminal terminal drug addicts. They can and will do this thing next, right? When you have people who can, in a dark moment, get off their insulin, stop their dialysis, and even go so far as to stop eating and drinking in order to qualify for lethal drugs, which didn't happen in Colorado, but has happened in Oregon. There's a woman named Cody Sontag. Last year or the year before, she got a dementia diagnosis. She was not experiencing any of the symptoms of dementia, yet she was perfectly physically healthy. Once she got the diagnosis, she found a kill me doctor who would qualify for her for lethal drugs if she stopped eating and drinking, which she did. She got the lethal drug prescription on day 5, dead on day 8 from assisted suicide, not from starving herself to death. And their law is extreme like similar, comparable to the Colorado law. Now, after that case, you have pro doctors and lawyers writing in their pseudo in their what I would it's not a peer reviewed journal. Okay, so they try to craft it as such, but it is not a peer reviewed journal. In their pseudo peer reviewed journal, they're writing articles about like how to use voluntary stopping eating and drinking as a bridge around the safeguards that they themselves put in place in these laws. Right. So that we're in a brave new world. I mean, this is a fast and loose set of public policies. It's purposefully opaque. There's no transparency. There's no ombudsman. Once those drugs leave the pharmacy, zero oversight. We're talking 1,000 times the therapeutic dose of morphine walking out of CVS. There's what proponent doctors called in an interview blue whale sized doses of morphine and another drug to stop your heart. That walks out of the pharmacy with zero oversight. If the person doesn't use them, there's no reclamation process. There's no paperwork to fill out. Yeah, there's been cases including Colorado, where somebody else in the family took some of the drugs. Um, 911 was called. They saved the young person who had taken a swig, and they're like, "Well, this guy had the lethal drugs too." And they're like, "Yeah, but that's legal, and he asked for them." Uh, the paramedics only didn't save the older person who had received the prescription in Colorado. They only didn't save him because he had a DNR on file, which, by the way, doesn't stop the paramedics from actually working on a person who is, DNR just means that you do not resuscitate. So you don't use the paddles, you don't, give CPR, but uh, who knows what exactly the person was experiencing, was dying, because there's also no regulation on what drugs to use. So your prescribing doctor could use literally anything that will kill you. Now, there are drug cocktails in vogue, which is why I can say it's 1,000 times the therapeutic dose of morphine, because they publish in their pseudo journal what they use. But the doctor didn't have to be there at the time of death. Nobody has to, there's no third party that verifies the person took the drugs voluntarily. There's no third party that verifies that the patient at the time of ingestion was self-administrating, which is part of the statute. There's no one checking to see if they had capacity at the time of ingestion. I mean, these are all serious questions about this public policy.
Wow. Definitely some serious questions. And I really appreciate your statement about what kind of society are we becoming? What are we willing to tolerate? What are we willing to do as a society in order to help vulnerable individuals? Do we write them off? Do we say, your life is not worth helping? You're not worth the treatment. Here, just go away and die. Or, the alternative is let's try and help these individuals, try and give them the treatment, the care they need so that they can live a fulfilled life. And it seems like we're going in the wrong direction here. And unfortunately, it's a pattern. And it's so interesting to me because we see it as compassion, right? Originally, that's the original argument. We're helping people who are suffering. We're helping them who are terminal, who don't have a chance to make it. And then so often, as with many government programs, it kind of expands. And, the legislature here in Colorado, as you mentioned, passed a law to change the program, to expand it to include some nurses to be able to offer this
Mhm.
this program to individuals. And it just seems like, the voters may approve one thing, but then the legislature comes in and makes some adjustments after talking to some interest groups, talking to some lobby organizations,
And very
talking to some of the
powerful interest groups with a lot of money that donate to their campaigns, by the way. Colorado also shortened the cooling off waiting period from 15 days to 7 days. Now think about this. If you're in Colorado, if you are a person with disabilities and you need accessible housing, you get on a waiting list. You might not get it for a year. Where are you going to live? You might need a wheelchair. Say you're approved by Medicaid for the wheelchair. This is a state program. You might not get the wheelchair for over 6 months. It could be a year. Some people wait a year and a half. Now you don't have mobility. Um, if you one of my allies in California, I don't know what the wait time is in Colorado, so please forgive me. But in California, she said to me, Matt, if you're on Medicaid in California and you are in a mental health crisis, unless you somehow get yourself into the ER, which may or may not be in somebody's purview to do, you are not getting a mental health consult for 72 hours. And in California, you can get lethal drugs in 48 hours. Right. So in Colorado, you can get lethal drugs in 7 days, but you can't get the things you need to live and thrive in 6 months or a year. So let's just be clear, like it's unknown and unclear whether or not Colorado's Medicaid is covering assisted suicide. They may or may not be covering it. They may not know that they're covering it if they are covering it. So the consults could be listed by the attending physician as end of life consult. Then they bill it back to Medicaid and the state's paying for it. They could also spread out the lethal drug cocktail. If the person's not imminently dying, they spread it out and get it covered in a different way. Who knows? What I do know is if the state is knowingly covering this, they're doing so in order to save money because you spend a whole lot of dollars in the last 6 months of your life. And so, are we going to, again, as a society, are we going to provide the things that people need to live and thrive? Or even just have a peaceful and natural end of life? Or are we going to encourage them to an early end? And so I don't actually think that there's a safe way to do these laws. I get asked this all the time by journalists. Like, well, what would you do to change the law? The, these laws never, to your point about passing by the people, then the legislature takes it a step further. They never get tighter. They never get more careful. They never exclude certain groups that were included originally from getting lethal drugs. They never lengthen the waiting periods. They never add any protections after the drugs leave the pharmacy. They never get tighter. There's not additional reporting required. The data that we have on this, there's a paucity of data. So think about it. Only participating doctors submit information to the state. The information that they submit, not all of it's published. You get a report once a year from the state that is just some of the information that participating physicians provided. If they were breaking the law, why would they tell the authorities? Right? So it doesn't make any sense. So now, if they do not follow what the statute says in terms of reporting, there are no repercussions. Nobody's ever been prosecuted for not providing all the documentation. What documentation is requested by the state, and that the doctors, in many cases do provide, is not nearly the sort of data that would be helpful in determining whether or not this is safe, or it's working as intended. We have no idea if it's working as intended. That's part of the big problem here. It's purposefully opaque, zero transparency. You ask the state in a Freedom of Information Act request for information, they're like, no, they won't give up the ghost. Why? Because they have something to hide. These are the sorts of things that make us not only question but see the ugly underbelly of this. It's all sold always as, oh, this is more autonomy and more choice at the end of life. And I can see from some of your signs behind you, you wax libertarian there. And many libertarians, right or left of center, I mean, they all see this as like, oh, good, get the government out of our way and do what we want at the end of our lives. In fact, a strict libertarian would be absolutely opposed to these laws because it actually injects both the government and big insurance and government insurers and big pharma all into your end of life decision making. Um, our organization is secular. We're nonpartisan. We work primarily on a set of issues wherein people are being devalued to death. We can work and do work with people who are very far right and very far left, and everywhere in between. All these people oppose assisted suicide laws because human dignity is at stake. Even if you think the government should be out of every decision you're making, we don't say we take no position on the moral or ethical implications of somebody taking their own life. We have a problem with the public policy putting into the hands of the state and the medical establishment who lives and who dies when they hold the purse strings so oftentimes and they have in the power dynamic, they absolutely have the upper hand. And especially when, as you mentioned earlier, there are people in these difficult circumstances, getting a tough cancer prognosis and diagnosis, that's hard. And like to navigate that, to navigate a complex medical system that's broken, not really always serving people in the best way, it seems to me like there's a place for us asking hard questions about whether or not this is truly a good public policy. I think you'll always have to ask him with public policy, who can be hurt? How does this affect everybody? And when vulnerable people are going to be hurt, uh, the ends don't justify the means. You know, like, to even if you were okay with the idea of doctors doing this thing and the state having this law, the fact that there are a number of people who are getting these drugs that do not fall into what most proponents see as the ideal candidate for assisted suicide. You're getting people like, you know, getting off their insulin in order to qualify for lethal drugs because they have acute clinical depression. And this is their avenue to getting lethal means. Right? There are people who, like Jane, were in a super vulnerable spot. They're like hopped up on morphine. Like her brain is literally on starvation, not working correctly. And they're suggesting this person has capacity to make medical decisions and a medical decision that's not reversible. It's like one thing to say like, oh yeah, I'll qualify for hospice. Like people graduate from hospice all the time, huge percentage. You're dead. You don't undo that one, right? So I think, with these laws, um, there's something awry here when we can't have an honest conversation, when we can't actually just say, no, yeah, I'm at proponents and your legislators now that their hands are not clean of this because they now are amending the law to make it even easier to get. They have to know that some people are going to die that they would see as cases that shouldn't have happened, and that they got to be okay with that. Now, there are people like me. I just don't think there's any good, safe way to do this, and so I would categorically oppose any assisted suicide law. It's just always there's always too much room for abuse, and even if you were to add additional safeguards, it's impossible to regulate, control, and to keep people safe.
When Matt, in your article, you quote Jane as saying she felt coerced into suicide. Can you explain how that, I mean, you kind of already explained how that might happen to somebody, but can you go into that a little bit in terms of the coercion aspect?
Sure. So in her particular case, I'm going to talk generally in particular. I'll start with particular, but in her particular case, the patient-doctor relationship is imbalanced. Her doctor has the upper hand. Not only that, she herself is on starvation. Her brain, they've done a bunch of studies on people with eating disorders, and your brain doesn't work correctly. You cannot cognize and make decisions when you have not been eating right. And this person was not eating right for a lot of time. Right. So when your doctor then suggests something to you that you have never thought of before, and that doctor also happens to know that you are suicidal because they're your psychologist, whichever one. I don't remember which one this particular doctor was. She knew she was suicidal. And here she's like, well, here's one way out. When you look, like autonomy requires that there's a range of choices and that you're empowered to make them. If you neither have the range of choices nor are you empowered to make them, it's coercion. So this doctor was making the suggestion to her. She was implicitly encouraging her and then explicitly providing her the opportunity to get these lethal drugs and facilitating the process, even to the extent that this physician went to the guardianship hearing and advocated for Jane such against the father from getting guardianship, uh, and saying very clearly that she thinks that Jane should not have a guardian, that she is capable of making her medical decisions, and that she should have the right to have assisted suicide drugs. That's how coercion works. So oftentimes behind closed doors. And in this case, um, yeah, here's a person who's covered by HIPAA until Jane herself spoke out to the media. I mean, to the media. She wrote this down in an email that she would wanted to publish. So here you have somebody who's protected, and they can say whatever they want behind this closed door. It's none of it will ever come to light in most cases, and there's subtle coercion and explicit coercion. If somebody were to bring up themselves, say, unlike, I mean, Jane had requested the lethal drugs on a number of occasions after this doctor brought up the idea. Um, Now, if somebody proactively asked for the drugs, their family or their doctor saying like, well, okay. Instead of saying, no, we don't leave us like that. No, no, no. Let me, we'll walk with you. We'll get you all the treatment you need. Like what's going on? What's precipitating this request? You know, there was a guy in Oregon who made a request and his doctor was like, let's talk about this. Like this doctor happened to be an opponent of assisted suicide. But he didn't like just categorically say, no, I don't do that to this patient. He talked to him. What's going on? After a long conversation, he realized that the straw that broke the camel's back for this guy was that he couldn't go to his grandson's baseball games because he couldn't quite walk to the field from the car. He had a degenerative disease. He was terminal. His doctor got insurance to cover his scooter, and his desire to die evaporated. He didn't ask for the drugs again. He lived to his natural death from the disease he had. There are a myriad of both real life situations like that and and hypotheticals that you can imagine where if the doctor had said like, well, yeah, okay, Chuck, sure, well, if that's what you want, like we support your autonomy and your decision, like that itself is a sort of societal pressure. And um, if for people with disabilities who are told things like, I'd rather be dead than live like you, or they face an uphill, demoralizing battle just to get basic care, um, the whole world basically lives like they'd be better off dead than disabled. And so if you have the opportunity to get lethal drugs, you might just take them because you are facing barriers to access at every juncture, maybe even barriers to access to care that you need to live or live outside of an institution. I've heard many people in the disability community have said to me, Matt, I would rather die than live in an institution. And many of these institutions are terrible, right? It's not a nice place to live. They feel like they are um, their dignity is trampled upon in these institutions in many cases, right? So they, again, many of them just auto-qualify at all times. One of the plaintiffs in the Colorado lawsuit is an organization called Atlantis Adapt. They are a Denver-based disability rights street action group. You know, they're the kind of people that would chain themselves an office of a legislator who's trying to cut Medicaid or something like this, right? Um, they lost a 24-year-old member to assisted suicide. Now, I don't know all of the circumstances, what her conditions were, but she wasn't from their understanding, and ostensibly wasn't near death. Maybe she was suffering from her conditions. She had been living at a nursing home with octogenarians in her 20s because she couldn't live independently, faced barriers to access to living independently, so had to be taken care of at this facility. She had a health crisis from which she recovered, and her family all flew in. And she said, "Well, they're all here. They all came, to say goodbye to me. I might as well just give them what they came for." That was from a conversation, direct quote from a conversation she had with one of the Atlantis Adapt members. They didn't have enough time to get her support and the care that she needed to get her out of this dark moment. And she took the drugs and died at 24 years old.
Wow.
So it's quite possible she had a degenerative disease that she would have ultimately passed away from. It's not something I happen to have access to the knowledge of, but irregardless, like a doctor wrote her a script at 24 years old instead of trying to get her some hope at the minimum. Not necessarily hope to recover from such a disease, but just somebody who cared about you enough to say, no, let me walk with you. Let me get you the end of life care that would give you the opportunity to live out your days with dignity and with peace. That's not something that we're doing if we're legalizing assisted suicide and giving a cheap and easy way out for both the state and medicine. When you have like a complicated situation, medicine can't do something for this person or doesn't know how. This is where I see the coercion really happening. In Jane's case, for example, here's a doctor who she wasn't able to do anything for Jane. Jane left her care and some other person was able to do something to help her. She recovered with this other person. The first doctor, in her pride, would not allow the thought to enter that perhaps there'd be somebody else that could help. No, no. Jane's terminal. If I can't help her, nobody can. And Jane even told me that. She said, this person had told me that she convinced me, and this was another part of the coercion, that she was the only person who could help me. And I believed her. She said that to me. She's like, I believed her. And this is part of the web of coercion. There's a young woman with anorexia who's also a plaintiff in the lawsuit against the state of Colorado. She doesn't live in Denver, but right outside. A woman named Mary Gossman. So Denver is kind of a hub for eating disorder treatment. There's a world-class, nationally and internationally renowned residential treatment center there that told Mary, they discharged her. And on discharge, they said, look, like there's nothing else we can do for you. You're impenetrable. Mary was suicidal at the time. And she said, I was suicidal, but I didn't want to die. I just didn't, I couldn't see myself living anymore. As there was like such suffering and internal turmoil, whatever was driving that, I don't know. She somehow, in her inner core, resisted that and got herself a psychiatrist that was outside of the eating disorder world. This person helped her. She got herself, again, got her for herself a nutritionist. Now she's back up to healthy weight. She's in a good place. She's not out of the woods or anything, but for all intents and purposes, on the road to recovery. And she just got married. Beautiful story, right? On the day that she was discharged from that facility, she qualified for lethal drugs in Colorado in her 20s because they told her her case is hopeless. This is the reality that everyone in Colorado is living under right now.
Wow.
If some doctor considers your case hopeless and your condition happens to have life-threatening, it's potentially life-threatening, you qualify for lethal drugs. if you just in a dark moment, you get off of the treatment that you're receiving, or even voluntarily stop eating and drinking, you qualify for lethal drugs in Colorado. That's not the kind of place I want to live in. To be
No,
perfectly honest.
no. Wow. Matt, I really appreciate you sharing all this information, really informing people about this policy and the disastrous or heinous effects, I think is the proper word for it. But kind of as we wrap up here, do you see anything changing in terms of the nationwide view, the kind of this cultural view of assisted suicide? Do you think the tide is turning at all, or is there still just a lot of work to be done?
Both and, if I had to be honest, I mean, you see in some sectors of society a kind of increased openness to legalization because it's not just nationwide, but a kind of Euro-American West. And I say American in the broad sense, even South America. Even just this past week, Uruguay legalized euthanasia. Okay, so there are a half a dozen countries in Europe currently considering legalizing assisted suicide and euthanasia. However, um, our northern neighbors in Canada have kind of gone off the rails. I mean, it is to the extent where poor people are applying for euthanasia and getting approved. Their motivation explicitly is, I do not want to live under grinding poverty anymore. In Canada, they've expanded. They started where we are, started just the same way the Colorado law, so terminal illness. They have gotten to the point where they they are willing to euthanize people who have any physical condition that that person subjectively is believes is intolerable or the treatment for which is intolerable. That condition does not need to be terminal. They have two tracks. One is the terminal track, and it's pretty quick. The other, and it's not even terminal like 6 months or less, they removed the 6 month provision and say death is reasonably foreseeable. Well, my death is reasonable foreseeable too, by the way. Reasonably foreseeable. Track two is if you have any disability whatsoever, explicitly disability. So the UN this year took Canada to its UN court and said, you cannot have track two anymore if you want to. You signed human rights treaties, and this track two violates your human rights treaties. You have to rescind it. Now we'll see what they do, but the only thing that they've done is expand, and they recently passed to now not only physical disabilities, but also mental health disabilities. So in 2027, it's set to go into effect that literally any mental health condition will qualify you in Canada for lethal drugs. There are calls by an official select committee of the Parliament of Canada saying that we should also offer this to mature minors. In other countries, they already do offer it to minors in the low countries. You also have in Quebec, Quebec's at the bleeding edge of this thing. In Quebec, they just legalized to elect for euthanasia and assisted suicide via advance directive. So somebody else is going to be making this decision for you, by the way, because they might just interpret your advance directive one way or another after you lose capacity. This has really woken people up in the US. I have seen it. Legislators are peaked to this. They see the news cycle. It seems almost every other week there's a horror story coming out of Canada. And Jane's story is just one out of many horror stories here in the US. People are starting to question, even if they on some level have no problem with the principle of the idea, starting to think to themselves like, this is not what we signed up for. And I think that's happening in Colorado, and I think it's happening across the country. So evidence of this. Um, Deep blue states like Maryland, Massachusetts, Connecticut, and up until this year, New York, uh, have rejected resoundingly um, multiple attempts over a decade of attempts to legalize, just stonewalled. You have papers like the New York Times that wouldn't come love nor money, would never publish anything from our side. Now they're publishing stuff from our side. Um, the the Chicago Tribune. This past session, we asked for a editorial board meeting with them and the Chicago Sun. The Sun was neutralized. The Tribune, even as an editorial board, wrote in opposition to assisted suicide. They said, we've heard from both sides. We understand. We just think it's too dangerous. Vote no. And you're on the Denver Post. During the ballot initiative, this is really interesting, little historical fact. During the ballot initiative in 2016, the two sessions prior to that, bipartisan no on assisted suicide. Actual votes were taken in committee, killed both times, which is why the proponents had to take it to the ballot. During those sessions, the Post was pro. During the ballot initiative, we asked for, again, an editorial board meeting, and they met with, progressive disability rights advocate, a physician, and a cancer patient who had outlived his prognosis. Because this is the other problem with prognostication. 6 months or less is so arbitrary, but even even if you think it's a good litmus test, doctors are at the 6 month mark, doctors are more often wrong than they are right about that prognosis. So this guy had outlived his 4 month prognosis by 3 years. He's like, look, if like assisted suicide were legal at the time of my diagnosis and that 4 month prognosis, I probably would be dead right now because he lived in New York at the time. So he met with the editorial board of the Denver Post. They had come out with an opinion saying, vote yes. Then they said, we've been doing some soul searching and we were wrong. Like, can you imagine like editors of the Denver Post? It's not normal that people in that position in that world, like they don't often eat a lot of humble pie. They did. They said, we are doing a 180 on this. We think you should vote no.
Wow.
That's impressive, right? And I think that comes from um, these question marks, these stories, these personal stories of real people being truly harmed and discriminated against in a society that's supposed to be free, and it's not. When you again when you don't have the range of options and you're not at liberty to make them, when coercion always happens behind closed doors, when not everyone has a nice family, assisted suicide laws are a train wreck.
Wow. Well, I really appreciate all your efforts, Matt, and your organization. As we wrap up here, any final thoughts, any ways that people can support your efforts?
So, Colorado, the lawsuit is at its beginning stages. As the thing progresses, if we are given the opportunity to litigate this, we'll need stories. So, anyone who has had any direct experiences with the law itself, I'm not talking about what some people call stealth euthanasia, where they think the nurse killed their dad in hospice because she gave him too much morphine or something. I'm talking about actual direct experience with the statute itself, whether you're a doctor who had a patient request the drugs and you got them good care and then they decided not to do it, a doctor who may have lost a patient to assisted suicide because another doctor would do it, a family member who's lost somebody, um, somebody who asked for lethal drugs and got them but changed their mind because their family supported them, whatever. It could be anyone who's had direct experience with the law. We're open to and listening and talking to those stories, to people with those stories, and they will help to prove the case. We have some already, but adding to that would be very beneficial. Additionally, have conversations with your friends and family about this, whether around the dinner table or, you know, send them this podcast or this YouTube video. Like talk about it in a way that's like, this isn't what you think it is. Maybe have you considered this? Have you read this article? Have you thought about it? Talk to people and give them an opportunity to think about it in a different way. As most oftentimes, you don't need to necessarily convince people that they're wrong and you're right, but just give them second thoughts about whether or not this particular public policy is a good one. I would also say that keep informed, know what's going on in the issue. You can go to our website, which is praf.org, Paul Ralph Adam Frank, for the C4, which is our political nonprofit. And then for the C3, it's Institute for Patients' Rights.org. And to keep up on the lawsuit efforts, which are not sequestered to Colorado, we've also sued the state of California, and there will be more to come as we head to the Supreme Court to abolish assisted suicide nationwide for good. You can learn more about that effort at endassistedsuicide.org.
Wonderful. Well, thank you so much, Matt. Really appreciate the time you took today to discuss this issue and inform people here in Colorado about the effects of this law. So please keep us up to date with anything with the lawsuit. But thank you again, sir, and really appreciate you.
Thank you, Brandon. Take care.
Take care.